Hi everyone, my name is Macy Bartley and today I'm going to be talking about my final paper. So in the beginning of my paper, I just discussed my health issue, which is the rising maternal mortality rates in the United States. And basically I describe what this problem is. I talk about how mothers in the US are dying while giving birth to their child or after birth. In the United States, we have a really high rate of this compared to other countries with the same financial status, so it's becoming a problem. I said one factor to this is access to healthcare, so that's kind of what I based my whole paper around, was different things that affect access to healthcare and some factors. So in the first few paragraphs of my paper, I talk about why my health issue is so important. And the first reason I mention is from an ethical standpoint. It's important to care about the mother and enhance her experience during childbirth. I also said how this issue is affecting children and families. So the consequences of maternal mortality affect children who lose their mothers emotionally, socially, and economically. And this often has a rippling effect, extends over generations. And then another point that I brought up was that this issue can be an indicator of the overall US healthcare system, because since our rates are so high compared to other countries with the same financial status, we know that there's something going on with our healthcare system that needs to be changed, and so we can implement different actions to help with this. Okay, and then also in my paper I talk about how there are short-term and long-term effects that go along with this health issue. So one of them is obviously the health effects on the woman. Women are dying from this health issue, and this serves as a long-term effect for the families and the children of this mother. And then also another effect that is shorter term is a longer hospitalization stay. So this issue can cause families to stay in the hospital for longer, which also then increases the medical costs. And so those are some effects. Okay, and then in my paper I talk about my target population. So my target population for my campaign is healthcare systems / professionals. And the reason I chose this was because I feel like they can do the most with the situation, because they're the ones directly talking to the patients and implementing new actions. Changes in recognition of this issue to healthcare systems and professionals can help them to change the way systems are acting in the United States in order to achieve the outcome of decreasing maternal mortality rates. Okay, and then I talked about the various factors significantly shaping the impact of health messages on healthcare systems and professionals, influencing how information is conveyed, received, and acted upon. And then in my paper, I talk about some research that I've done. So the first article that I read was Rethinking Maternal Healthcare for the 21st Century in the United States. And basically, this article discusses the United States maternal mortality rates compared to other countries. And it specifically talks about Canada. And so Canada has reduced their maternal mortalities by implementing different systems. One of them is a system that monitors and provides direction for maternal child care and newborn indicators to inform policy development. So through this system, Canada was able to decrease their maternal mortality rates, and so the US can use this as an example to also decrease theirs. Also, Canada has raised public awareness about this matter, and so that also helped to decrease their rates, and the US can also do that. One of the ways is through campaigning. And then this research also discusses California, which is a state that has one of the lowest maternal mortality rates in the US, and this is because they have different systems like Canada that help to decrease these rates. So one of the things the California government has implemented is the California Maternal Quality Care Collaborative, and basically this provides information for both the mothers and the healthcare workers that help them to receive data and education so that they can decrease these rates. So, for example, they have a website where healthcare professionals can watch presentations and listen to audios from other healthcare workers to gain information on how they can help their patients. Okay, and then another article that I found and researched was inadequate maternal health care for women in the United States. And this article discusses that maternal mortality rates in the US are an important issue that can be decreased by making aware of and reducing insufficient maternal care. And one of the ways that it talks about doing this is by providing information about midwives, which are healthcare professionals that help women deliver babies and also inform women about prenatal care and aftercare. Okay, so a quote that I included from this article is, aside from these care services, midwives also provide education on fertility, women's nutrition and exercise, pregnancy health, breastfeeding practices, and quality infant care. So this shows that midwives are an important asset in decreasing maternal mortality rates because they provide women with a lot of information that they might have not had before or wouldn't get from a shorter visit from their doctor. So bringing awareness about midwives can help to decrease maternal mortality rates. Okay, and then another research article I found is called Strategies and Actions Improving Maternal Health and Reducing Maternal Mortality and Morbidity. This article explains that there are different actions that can be taken to decrease the rates in the United States. And so one of the ways it says is through research. So in the United States, there's gaps in research in the maternal mortality rates and the factors of what cause these women to be dying during childbirth or after childbirth. And so by researching these, the factors can be introduced to healthcare professionals and healthcare systems, which can then help to fix them. Okay, and then also in my paper, I talk about an article called Strategies and Actions Improving Maternal Health and Reducing Maternal Mortality and Morbidity. So this article explains two actions that can happen to reduce these rates. So the first one is research. It talks about how there's gaps in research in the US for maternal mortality rates and the factors that cause women to be dying during and after childbirth. So by finding out this information, healthcare systems and healthcare workers can work to provide women with better care and use the information of the factors to prevent women from dying. And then also this article talks about how education can be an important way in decreasing these rates as well. Okay, and then in my paper I talk about how researching and gaining new information about the rates of maternal mortality in the United States will help with my campaign. So in some of the articles I found statistics that would help to inform people about this issue that's going on and hopefully bring awareness to them. And then I also mentioned some communication channels that I would use. So the first one being social media. I feel like many people are on social media now. So Instagram, Facebook, even TikTok. People would help bring awareness to this situation. And then also I said broadcast media, and so that includes like the television and the radio. Okay, and then I want to talk about my health messages that I created for my campaign. So the first one I made was a health message that can be put on websites. So this one is called Journey to Improved Health Maternal Results. So this is the journey, right? So this is the journey. And then I included some information about maternal mortality rates. Okay, and then the second hypothetical health message I made was a hashtag saying Save Pregnant Women on an Instagram post. So as you can see on this Instagram post, I included a graph that shows many countries' maternal mortality rates compared to the US, and it shows that the US has a way higher bar than all the other ones. So hopefully this will emphasize that there's an issue to people. Thank you so much.